So now we'll discuss questions, and I'll show you the screen of the questions, and you can just read the question and tell me the answer. A patient admitted to the emergency department, injuries and broken femur from a motor vehicle accident, and the patient is pale, diaphoretic, and not talking coherently. Vital signs upon admission: temperature 36, heart rate 130, and respiratory rate is 43, and BP is given 60/50. And the healthcare provider suspect which type of shock: cardiogenic, neurogenic, distributive, and hypovolemic. You can drop your answers in the chat box. Yes, exactly. It is hypovolemic shock. Okay, very good. Next question. A 28-year-old male is recovering from moderate concussion following a motor vehicle accident 2 weeks ago, when he suddenly develops an increased thirst craving cold water, and the patient urinates very large amount of dilute water like urine with a specific gravity of 1.001 to 1.005. And the patient is most likely developing diabetes mellitus, diabetes insipidus, hypothyroidism, and thyroid storm. You can just drop your answers in the chat box. Here, the meaning of the question is: patient had a motor vehicle accident and there was a concussion in the head. And following that, the patient has started increased thirst, craving for cold water. That itself is indicating that dehydration in the body, and the patient urinate large amount of diluted urine. So urine excessively, the patient is urinating, and it is considered as a diluted urine, and specific gravity is much lesser. So what can be the reason? Diabetes mellitus, diabetes insipidus, hypothyroidism, and thyroid storm. Yes, exactly. The what is the answer? Yeah, the answer is diabetes insipidus, not diabetes mellitus. Don't get confused. Diabetes mellitus is a condition where carbohydrate metabolism alters as a result of deficiency of insulin. Insulin alavu korayanoണ്ട്, sugar carbohydrate metabolism altered ആയിട്ട് hyperglycemia undayi. As a result of hyperglycemia, excessive urination undavunnathaanu diabetes mellitus. Whereas in diabetes mellitus, specific gravity of urine will be almost normal. Okay. അതായത് സ്പെസിഫിക് ഗ്രാവിറ്റിയിൽ ഒരു മേജർ ഫോക്കസ് ഡയബറ്റിസ് മെലിറ്റസിൽ വരുന്നില്ല. But diabetes insipidus is a condition where it is caused by deficiency of ADH, antidiuretic hormone. Okay, antidiuretic hormone or vasopressin എന്ന് പറയും. So antidiuretic hormone in the deficiency karanam, antidiuretic hormones are normally acting on the renal tubules, and it is helping to absorb more water. Fine. But because of deficiency of ADH, there won't be any action on renal tubules. As a result of that, renal tubules reabsorption of water is not going to happen properly. As a result of that, whatever we drink or the entire water get excreted as urine or through the kidney. Okay. അങ്ങനെ ADHന്റെ ഡെഫിഷ്യൻസി കൊണ്ടുണ്ടാവുന്ന കണ്ടീഷൻ ആണ് ഡയബറ്റിസ് ഇൻസിപ്പിഡസ്. ഡോണ്ട് ഗെറ്റ് കൺഫ്യൂസ്ഡ് വിത്ത് ഡയബറ്റിസ് മെലിറ്റസ്. ആൻഡ് പ്ലീസ് നോട്ട് polyuria is expected also in diabetes mellitus and in diabetes insipidus also. But what is the peculiarity? The specific gravity of urine is much less as a result of dehydration. That is expected in diabetes insipidus. Okay, so that is the difference. Okay, how do we differentiate between these two things? And next thing is, already in the questions they specifically mentioned that patient had an injury on the head, and following that all the symptoms was started. Fine. So pituitary gland is producing, the posterior pituitary gland is producing ADH, and pituitary gland is situated in the brain. Okay, so you can just simply relate this. Clear? So the answer is not diabetes in mellitus, it is diabetes insipidus. Okay, any doubts, anyone? Those who have selected answer A, clear? Are you all clear, or do you want me to explain again? I think it is not necessary. Okay, okay, fine. And you are most welcome to ask in between the discussion any kind of questions related with any topic. Okay, it should be something related with the licensing exam. Okay, but I can assure you that I can give answer for everything. Okay, fine. And next is, the nurse has just administered insulin to diabetes client, and in which of the following ways should the nurse dispose of needle? This is like very simple. I don't want to explain anything more. Go through the option and select the answer. See, these questions are like very simple, and but you may get confusion. See, I won't answer from everyone, because everyone must be working in different agency. So the agency protocol, I can understand. Yeah. So two answer we got, like a burn the needle and discard in the red bag. In which agency this procedure is followed? Can anyone specifically tell the agency, name of the agency? I have not yet heard and seen that burning of needle. I have seen, but discarding in the red bag, I don't feel it is. Okay, C. And yeah, okay. C, needle and sharp should be placed in the nearest puncture resistant container. Yes, can be. Any other other answer? Shamsina's B. Needle should not be recapped. Yeah, that is good. And should be placed in a puncture resistant container, not just any biohazard container. Okay. So which one is the correct answer, C or B? So what B says is needle should not be recapped and it should be placed in the puncture resistant container, not just any biohazard container. So it is like all these are included in a biohazards group, fine. So very clear is needle, not only needle, all the sharp should be placed in the nearest puncture resistant container. Okay, so better answer when we compare between B and C, the answer is C. Okay, next. Tested positive for gonorrhea, which of the following medication should the nurse expect to be part of the treatment plan? So what is the choice of medicine for gonorrhea? So exactly the answer for any options other than D? Yes, everyone have selected D. Yeah, very good. So the answer is ceftriaxone. So those who don't know the answer, you can just learn the choice of treatment for gonorrhea is ceftriaxone. Okay. Next. An older adult client with a history of blood clot is in the emergency room with a suspected deep vein thrombosis of the left leg. The nurse starts IV heparin as ordered. Which of the following is least likely to be included in the care plan? Which one of this is included, least likely included in the care plan? Ampulation as tolerated, warm moist sock applied on the affected area, analgesics, anti-embolism stopping. What is the answer? Yes, answer please. So Wahida selected D. This is for this question or previous question?
This question, ma'am. Talking
So
salt.
what is the meaning of this question? Read the last sentence. Which of the following is a least likely to be included? Least likely to be included.
Okay.
Least likely to be included, which means which is not at all important. Anti-embolism stocking is important. Analgesics you can provide. A and B, I don't feel it's important. So, but you can't select two answers. You have to select only one. So you have to ask these two options that whether this option will kill the patient. Okay, so you just ask option A, ambulation as tolerated. When this patient perform any kind of ambulation, uh, would that cause any harm for the patient? And same you ask to B also. When I apply warm and moist soak on the affected area, would that cause any problem for the patient? And in which question you got answer yes, then you can select that answer. Okay, everyone have selected B, and I'll just explain what is the effect of A and B on this patient. See, this particular patient is having DVT, that means clot in the major vessel, and patient is receiving anticoagulant. And okay, so when a patient who is receiving anticoagulant, because of the action of anticoagulant, the clot is literally detached from the wall of the vessel, and above all, if you perform activities, it increases the vascularity inside the body, and there may be chances to get dislodgement of that clot as a result of medication. And because of ampulation, that clot might dislodge and it will move faster and faster because your body is doing like active. So the blood, as the blood flows faster, the clot will also move faster and it will reach in the pulmonary. It first of all, it will reach in the heart, and then from the heart, it will be pushed to the lungs, and it may cause pulmonary embolism. And obviously, pulmonary embolism would cause a major problem for the patient. Yes, it will. Option A will kill the patient. Okay. And B, warm moist sock applied to the affected area. Again, when you apply warm moist, warm moist application, it dilates the blood vessels. When the blood vessels are dilated, the blood supply will also increase. Even that will also kill the patient. Then compare between these two things and which of the following have the highest risk, ambulation or warm moist sock. ആംബുലേറ്റ് ചെയ്യുമ്പോഴാണോ വാം അപ്ലിക്കേഷൻ കൊടുക്കുമ്പോഴാണ് ഈ ക്ലോട്ട് ഫാസ്റ്റ് ആയിട്ട് മൂവ് ചെയ്യുന്നത്? In which of these activities the clot will move faster? A or B?
Ambulation.
Yeah, it's ambulation. So what is the answer? This will be the this will be the same situations you are going to face during your exam. So what you need to do is remove the wrong answer, and then if you get the last two answer, you have to ask each option. Would you cause damage to the patient? Okay, would this particular option will kill the patient? Yes, it will kill the patient. If you get the answer yes, you can select that particular answer as a first. Clear? So the answer is A. Next question. The nurse in the primary clinic is caring 68-year-old man. History reveals that the client has smoked 1 pack of cigarettes per day for 45 years and drinks 2 beer per day. He is complaining of non-productive cough and chest discomfort and dyspnea. The nurse hears isolated wheezing in the right middle lobe, and it would be most important for the nurse to complete which of the following orders? Pulmonary function test, echocardiogram, chest x-ray, and blood test. Yes, drop your answer. Yes. Okay, it's chest x-ray. Any other answer? Yes, very good. It's chest x-ray. Very good. Okay, next question. Any doubts? If you want me to explain the options and questions, you can just again type in the chat box that repeat the question so I can explain. Next question.